That was an example of a concussion happening in a real game. Obviously, that was not made up, but it happened. A concussion is a traumatic brain injury that affects the way your brain functions. Although concussions usually occur from a blow to the head, they can also occur from the upper body to head being violently shaken. According to the CDCP, or the Center of Disease Control and Prevention, TBI can cause short to long-term changes in your brain. These changes include thinking, sensations, feeling, and emotion. These changes may lead to problems with memory and communication, some personality disorders, and an onset of dementia. You may have seen the Super Bowl game with the New England Patriots and the Seattle Seahawks this past year. If you did watch that, you saw Julian Edelman, a wide receiver for the New England Patriots, actually get hit very hard in the head during the game. He was immediately sent off to the sidelines and tested for a concussion like NFL protocol states. Well, after he was tested for the concussion, they said he didn't have one, so he just went back in the game to play. Well, reports came after the game from fellow players and the coaching staff saying that throughout the game, he actually referred to the team that they were playing as the St. Louis Rams as opposed to the Seattle Seahawks. This is an example of a concussion. Concussions are becoming more and more common currently in the sport of football today. Today I'm going to talk about how concussions occur, what can happen if a concussion isn't treated, symptoms of concussions, prevention, and recovery techniques for concussions. The first question commonly asked is, what happens for concussions to occur? Well, obviously your brain sits inside your skull, but what you may not know is that your brain is surrounded by cerebrospinal fluid, which keeps the brain held in one particular spot, so your brain doesn't go flying around when your head moves. So, if a hard hit occurs or if your head is violently shaken, your brain can actually pass through this fluid and hit the inside of your skull. This is what causes the concussion. The next question is, what can happen if a concussion isn't treated? Well, according to the American Association of Neurological Surgeons, brain swelling has a potential to amplify the injury if a concussion occurs and your brain does indeed swell. If active bleeding persists in your brain, hematomas, or like large blood clots in your tissue, can enlarge. Like brain swelling, increasing pressure due to the blood clot in your head can cause neurological damage and can be potentially life-threatening. The next topic is symptoms of concussion. Some symptoms, research done by the Mayo Clinic, which is a nonprofit organization and medical research group, states that headache, loss of memory or amnesia, commonly referred to amnesia, and confusion occur. Other symptoms, according to the U.S. National Library of Medicine, are nausea and vomiting, loss of consciousness, and sometimes seeing flashing lights. The next topic is prevention. The NFL has gone to many ways to research and understand how to prevent these concussions from happening. From the 4th International Consensus Conference of Concussions in Sports, they saw that the #1 prevention technique that they can use to prevent concussions is to make proper tackling. Well, sometimes players, when players are in the air and they're going to catch the ball, sometimes the defensive players hit them in the head. Well, the NFL has recently incorporated this new rule called targeting. A quick summary of the rule from American Football Coaches Association is that the player cannot launch himself into another player using the crown of his helmet or the top of his helmet. The second prevention technique is to wearing your helmet correctly. What you may not know is that most concussions actually occur during practices of the NFL teams, and the reason is because a lot of the players just wear their helmets sitting on their head, but they don't connect the chin straps most of the time. It's pointless if you don't wear the chin strap because your helmet could come popping off anytime you get hit. So using the chin strap and wearing the helmet correctly is another big deal of prevention techniques. The next topic is recovery from concussions. The first thing and the most important thing is to get plenty of sleep. The second thing is to avoid physically demanding activities. If you do both of these things, as the days go by, your brain will slowly begin to heal. As you can tell, the NFL has teamed with experts to make football safer for the players. To conclude, I'm referencing again the CDCP. Every day, 138 people die from TBI-related injuries. So please take concussions seriously because if not treated correctly, then they can be potentially life-threatening. Thank you.